What is the pain anxiety cycle and why is it important to be able to explain it to your patients? Hi, I'm Dr. Bryce. I'm an OB/GYN resident and mom of 5 in West Virginia, and I love talking about the pain anxiety cycle. What is the pain anxiety cycle? So as we have pain, we then get anxiety about the pain. As we have more anxiety, we then interpret that we are now having more pain, and as we have more pain, we have more anxiety and more anxiety and more pain, and it just kind of snowballs and cycles on each other. So one way to help manage pain is to break the pain anxiety cycle. How do you break the pain anxiety cycle? There's all kinds of, I'm sure you can see, especially on this app, all kinds of meditation and laughing and all sorts of things. But I do think it's important to get your patients to start thinking about that early on, because it can be a really great tool if you're, one, managing expectations. Yes, there will be pain. So there will be pain post-operatively. There will be pain in labor. If we can manage that expectation that it is not going to be a pain-free experience, then when they have that pain, yes, hopefully they don't have as much anxiety and that pain anxiety cycle doesn't start to snowball. So that's step number one. Step number two is getting your patients to think about how they might want to manage their anxiety and therefore their pain. And that can be all kinds of different things depending on what works best for them. For me personally, what works really well is humor. My husband is really great at making me laugh. So as I am in labor and I am starting to feel a lot of pain, as you do in labor, my husband's really great at getting me laughing, which takes my mind off of the pain, eases my anxiety, and then I can better handle that next contraction. So that's one way that I personally have learned to handle it. The other thing that I want you to think about as far as pain and anxiety is that a lot of people have experienced medical trauma. So the earlier that we can discuss this and that we can be there for our patients and that we can be a support for them by not being an added source of anxiety can also be really, really helpful. Some of the ways that I try to do that is by listening. I like to also do feedback. So when my patients tell me, for example, I'm really worried about Pitocin. Okay, tell me more about that. And then they will tell me whatever their fear or their worry about Pitocin is. And then what I try to say back is to do sort of a teach back or a talk back to make sure that I'm understanding what they're saying. And I say, so what I hear you saying is that you're worried about Pitocin, that it's going to lead to a C-section, one of my personal fears. I thought that if you got Pitocin, that meant that you definitely were going to have a C-section. And so then I can say, this is what I think is going to happen. We're going to start the Pitocin and then we'll have more regular contractions and I think you'll have a baby. So I'm able to kind of hear them and then reply back. And then we kind of are able to go back and forth. And the goal with that is not to get them to see my way, but it's for me to understand what their concerns are and then hopefully help alleviate their anxiety. So these are just some things that I try to do with my patients and why I think it is so important that you not only understand the pain anxiety cycle, both as a provider, but also as a patient, so that you can help manage your pain or your patient's pain. What are some ways that you think you might be able to better manage either your anxiety or your patient's anxiety to help break the pain anxiety cycle?